Hi, my name is Julie Donnelly, and I'm the developer of the Julstro Self-Treatment System for repetitive strain injuries that cause chronic pain and sports injuries. In this session of Stop Pain Fast, Why Muscles Cause Pain, I'll be explaining the muscles that cause a long list of pains, including low back pain, groin pain, hip pain, sciatica, knee pain, and even ankle pain. That covers a large area of the body, but it's all coming from spasms in three primary muscles: the iliopsoas, which is actually two muscles, the psoas and the iliacus, the quadratus lumborum, which is a low back muscle, and the rectus femoris, which is one of the four quadriceps. Let's begin with the psoas and the iliacus muscles. Your psoas muscle originates on the front side of your lumbar vertebra, spanning along the front of your spine and then crossing over your hip joint to insert into the very top of your thigh bone. When your psoas is relaxed, you're standing up straight. As it starts to contract, you begin to bend forward. If you're really flexible, you can bend all the way forward until your head is touching your knees, and it's all coming from your psoas muscle contracting. The next muscle is your iliacus. The iliacus originates along the inside curve of your pelvis and then merges with the psoas, and the two muscles are now called the iliopsoas, with both of them inserting into the inside top of your thigh bone. When your iliacus contracts, you lift up your legs so that you can climb upstairs or sit down. As they work together, you're doing any movement that makes you fold at your trunk at the top of your leg. Think about it. You're doing that at least 90% of your day, including while you're sleeping. In fact, the only time you aren't contracting these muscles is when you're standing straight or lying straight. The problem comes because of a phenomenon called muscle memory. Muscle memory dictates that when a muscle is contracted into a shortened position for an extended period of time, it actually changes and it shortens to that length. You then go to stand up and the muscle is too short. It causes the tendons to pull your lumbar vertebra forward and down. This pulling of the muscle tendons on your lumbar vertebra causes pain in the bone, just like pulling your hair will cause pain in your scalp. Plus, it puts pressure on the disc between the lumbar vertebra, and it impinges on the nerves that come out through the lumbar vertebra and go to your organs and to your legs. This can cause problems in your stomach, your intestines, and all the other organs, but we won't go into that problem right now. As your lumbar vertebra are being pulled down, not only do you feel the pain in your low back, but your pelvis is also rotating forward and down, causing anterior hip pain and putting a strain on your sacroiliac joint in the back. Next, as your pelvis is rotating, it causes one of your quadriceps, the rectus femoris, to become too long to do the job of straightening your leg. This happens because the rectus femoris is the only one of the four quadricep muscles that actually originates on the tip of your pelvis. The other three muscles all originate on your thigh bone, so they don't get involved. Your rectus femoris goes down your thigh and merges into the patella tendon, which crosses over your kneecap and then inserts into your shin bone just below your knee. The rectus femoris, along with the other three quadriceps, is responsible for straightening your leg. However, because your pelvis is rotating, the rectus femoris origination point has now moved down and the muscle is too long to do the job of straightening your leg. The body resolves this problem by tying a knot in the center of the muscle. However, when you then go to bend your knee, the muscle is too short. So it pulls down on your anterior pelvis, causing you hip pain, but it also pulls up on your kneecap, causing you knee pain every time you try to bend your knee. As the pelvis is rotating down in the front, it means your pubic bone is moving backward. This causes pain in your groin and in your inner knee, and the back of your pelvis is also at the same time moving up. Your hamstrings originate at the bottom of your posterior pelvis, but their originating point has just moved up, overstretching the fibers of the hamstrings. Your hamstrings insert at the back of your knee, so when they're being overstretched, you'll feel the pain at the base of your butt and at the back of your knee. You'll also feel your hamstrings, and they'll feel so tight that you think you need to stretch them. But that's the worst thing that you could do. They're already overstretched, and you could potentially tear them. Don't do anything to your hamstrings until you've treated your quadriceps and your quadratus lumborum muscles, and you've done a good stretch for the iliopsoas. Another thing that happens as your pelvis is rotating up in the back is the bone is pressing up into your sciatic nerve, and you may end up suffering from sciatica. Sciatica causes you to feel burning in your hips and your butt, and all the way down your thigh, your calf, and even into your foot. If you're an athlete, there's a good chance that you'll also experience chronic calf pains from this same problem. The next thing that happens is the muscles that all originate around your sacrum, around your the bone in the back. They're called the lateral rotators, and they'll go into spasm because of the rotation. And they pull on the tendons that insert on your thigh bone, causing hip pain and pain in your glutes. Finally, the top of your posterior pelvis is moving up, causing your quadratus lumborum muscle, which is called QL for short, to shorten. The QL inserts on your 12th rib, and it's responsible for lifting your hip up when you take a step. It's also responsible for pulling down on your rib to enable you to exhale. When it's tight, you could have some problems taking in a deep breath, such as when you're running or exercising, or when you need to cough. It goes on and on like ripples in a pond, but you can read about it by going to the link shown below. The good news is that if you self-treat your quadriceps, especially the rectus femoris, and then do the treatment for the quadratus lumborum, and finally the iliopsoas stretch, you can eliminate the majority of this problem in just a few sessions. I can teach you how to do that. Just go to my website. I hope to meet you at one of the Julstro self-treatment clinics that I teach nationwide. Thank you.